morning everyone, I am Dr. Satyabrata, MBBS clinical pharmacologist, and today I am going to talk on drugs used in symptomatic treatment of cough. We all know that there are groups of drugs used in cough like antitussives that that are cough center suppressants like codeine available as 15 milligram, 30 milligram tablet, and folcodeine, noscapine, dextromethorphan, and antihistaminics. Antihistaminics, there is levocetirizine 5 milligram OD in the evening, cetirizine 10 milligram OD in the evening, and benzonatate. And in the group pharyngeal demonstrates, there is lozenges, linctuses, and licorice. And in expectorants, there is sodium and potassium citrate, potassium iodide, guaifenesin, ammonium chloride, and in case of mucolytics, there is bromhexine, acetylcysteine, carbocysteine, and ambroxol. And for example, if there is productive cough, then we can use Grillintus BM syrup 2 teaspoons 3 times daily after food, and ascorin expectorant syrup 2 teaspoons 3 times daily after food, etc. And for dry cough, we can use ascorin D syrup 2 teaspoons 3 times daily after food, or rescuas syrup 2 teaspoons 3 times daily after food, etc. And if there is long-term cough, the cough persists, then cause to be identified by different investigations and treatment to be given according to the cause, and drugs to be given according to the guideline with precaution. Thank you for watching.